Hi, so today this video will be talking about meningococcal disease. Meningococcal disease is basically a disease that can cause meningitis. It can also cause septicemia. Well, meningitis is the inflammation of your meninges, which is the covering of your CNS, and septicemia is something that you do not want to have because 50% of the people who develop this die, and it basically means that the bacteria already had access to your bloodstream and it's releasing toxins everywhere. And it's a bad thing. Over here are just examples of what the disease can do to you. On the lower right, you see a boy with his arms and feet having to be amputated because of the disease. If he didn't, it would spread and it could possibly kill him. Over here just shows an illustration of meningitis, basically, because it causes increased intracranial pressure. On the upper right shows more of red blood cells, and the glass test. Basically, you do it when if you think someone has septicemia, and you get like a glass like this. Could be clearer than this, but you would press it against the rash, and as you put pressure on the rash and it doesn't go away, then that's a sure sign that you should get help quick. And here are just more pictures. I'm just showing you what it can do to someone and how important it is to know about this, because even though it's rare and not that many people have it, it's a pretty fatal disease. So it's important, and you could save someone's life with this, someone you love. So this whole video will inform you about how you can get this disease, the signs and symptoms, the mechanism, the prevention, the treatment, the complications, prognosis, everything. So stay tuned.
Coughing or sneezing on someone. Who gets the meningococcal infection? It can affect anyone at any age. However, children under the age of 5 years, especially babies, are the most at risk. Why? Because babies, they have low immune system. The second most common age group at risk is teenagers aging 15, 16, and 17.
Pathogens interaction. The reasons why invasive disease occurs in a very small percentage of individuals are not well understood. A variety of factors, including preceding viral infection, inhalation of dry dusty air, or exposure of passive smoking, have been associated with invasive disease. The meningococcus is able to adhere to non-ciliated epithelial cell through a number of adhesion factors, including pili. The bacterium has a number of mechanisms enabling to avoid host immunological mechanisms in the nasopharynx, including production of GIA protease, production of factors which inhibit cili activity, in the possession of polysaccharides capsule, which promotes adherence and inhibits opsonophagocytosis. The organism also undergoes notable variation in the level of expression to the structure of a variety of surface antigen, including protein and endotoxin, which enable the bacterium to invade the host immune response. In the case of Group B, meningococci, the polysaccharide structure is non-immunogenic because of structural similarity with the human neural cell adhesion molecule, or NCAM. While the event which enables certain strains of meningococci to pass through the nasopharyngeal membrane into the bloodstream remain poorly understood, it is clear that survival in the bloodstream and the ability to multiply to high members are an essential requirement for severe disease to occur. These can lead to impaired organs perfusion, renal impairment, pulmonary involvement, gastrointestinal consequences, central nervous system involvement during septic shock and meningitis, and many more.
The signs and symptoms of meningococcal meningitis can appear quickly or over several days. The patient who suspects to have a meningococcal infection may experience leg pain, tears, diarrhea, abnormal skin color, breathing difficulty, cold hands, and feet. It is really important that if you suspect that you have a meningococcal infection, that you may seek immediate intervention or medical attention, because an early diagnosis of the symptoms can result to a better result and an immediate intervention and treatment. So the symptoms may not progress. If the disease progresses, the patient may experience the classic features. This is developed later, or an hemorrhagic rash. The rash is not a typical rash. It is classified as red and purple rash, or it is considered a petechial rash. Now, it starts for a small spot and it develops within your small group, anywhere part of your body. Next, the patient may experience is neck pain or stiffness and photophobia. And the late features that develop are confusion or delirium, seizures, and unconsciousness. Signs and symptoms of shock include the toxic effect, decrease in conscious level, the skin may look pale or butchy, unusual skin color, capillary feel more than 2 seconds, cold hands and feet.
For the continuation of signs of shock, the fourth one is tachycardia or fast breathing, hypotension, increased BP, and respiratory symptoms or breathing difficulty. The fifth one is leg pain, as you can see to this picture, and the last one is the poor urine output. As we all know, the babies are most at risk to have an infection. You may suspect the baby to have meningococcal meningitis if the babies experience symptoms include excessive crying, which are not the usual cry, or it is high pitch and moaning. And then you can see that the baby's breathing is fast and unusual. And when the babies also experience fever because there is immunologic response inside the body, then anorexia, excessive vomiting. Because of infection, the baby can experience irritable and restless. Then they go through excessive drowsiness or sleepiness, and no matter what you do, it's hard to wake them up. Infants experience bulging fontanelles because of increased intracranial pressure. Then jerking movements may occur in the body and may appear stiff. Then the second to the last is sometimes the opposite occurs, appears floppy, and the last one is convulsion or fit or seizures sometimes develop.
So, meningococcal meningitis can cause death or other serious complications such as paralysis, gangrene, as you can see in this picture, that can lead to amputation, deafness in one or both ear, or the tinnitus or the ringing of the ears, blurring and double of vision, aches and stiffness in the joints, and learning difficulties. The other complication of meningitis is also brain damage, and the other is gangrene. So if bacteria enters into the blood, it can produce toxins or poison that can kill healthy tissues. So when bacteria kills healthy tissues, it can lead to gangrenous, as you can see at this picture. The most common or the major complication of meningitis is septicemia. It is the presence of numerous bacteria in the blood which are actively dividing. It can lead to organ dysfunction. It is a serious illness, often fatal. So how meningitis diagnosed? Aside from the symptoms, doctors must do a few tests to make an accurate diagnosis. They may include blood cultures. So this blood test involves placing the blood into a special lab dish to see if anything grows, such as bacteria. The other is chest x-ray, CT scan of the head, and lumbar puncture. So lumbar puncture, it is a medical procedure where a needle is inserted into the lower part of the spine to check if some of the organs of the nervous system is affected.
Meningococcal meningitis. Just a reminder, this kind of disease can lead to death or other complications such as amputation of extremities, brain damage, paralysis, gangrene, or even sometimes deafness. So we must act as soon as possible. Time is gold, prevention is better than cure. So, if you notice symptoms of meningococcal meningitis, you must seek immediate medical attention. Serious symptoms that don't improve with treatment, just like your fever goes up and goes down. You think you've been exposed to meningococcal meningitis. Just a little bit of reminder, meningococcal meningitis is human-to-human exposure and that can be transferred. The question is, how can we treat meningococcal meningitis? One is to administer antibiotics, such as penicillin, ceftriaxone by an intravenous line. The child may also need other medication to treat problems related to increased spinal fluid pressure. So, this is the picture of the vaccine. There are two types of them. Meningococcal conjugate vaccine, also known as MCV4. Menacra is approved for people ages 9 months to 55. The other, which we call this Menveo, is used in those ages 2 through 55 years old. So the next one is meningococcal polysaccharide vaccine, known also as MSV4. The only vaccine used for people older than age 55. Prognosis is majorly dependent on the type that antibiotics were given, and without treatment, most people will die. In the UK, about 1 in 10 people who have meningococcal meningitis without septicemia die. If septicemia occurs, then up to half of cases may die depending how quickly treatment is given.
Babies are the most at risk. Why? Because babies, they have low immune system. It's spread by contact with spit, phlegm, or other fluids from the nose. You can spread it by, for example, you can get it by kissing on someone that has the disease.
Or it can lead to, or it can be affected. Wala na na. Sibaw na na. Aray ko. Hindi na na. Sibaw na na. The other complication of meningitis is also brain damage. It's because it can cause shit, sa lagi ko eh.
Sige lang. When you can see that the baby's breathing or you can see that baby.
Ikat ko lang na the word.
The classical features, this is developed later, an hemorrhagic rash. It is not a typical rash.
Liwat na.
Shock and meningitis and many more. Liwat.
Liwat.
Dali lang na yun. The polysaccharide structure is non-immunogenic because of structural similarity in strains of meningococci to pass through the nasopharyngeal membrane into the bloodstream remain a very small percentage of individuals are not well understood. A variety of Di ba?
Sige.
Hindi ko kasi na-see.
The only vaccine used for people older than age 55.
Paul,
Prognosis ka pa.
Prognosis lagi ko?
or subject
Wait,
nila.
naku yan, prognosis.
Ikaw pag
Sige, sige, sige. Kaisampon mo lang.
Cut mo lang Japan.
Ano nang minutes? Kaipanan ko lang. So guys, remember, prognosis is generally dependent.
Liwat. Go, 1, 2, 3, go.
Ano?
2, 3.
So guys, please remember, up to half of cases may die depending how quickly treatment is given. Thank you.